As you know, in our body, there are two meniscus. On the lateral side, we have a lateral meniscus, and on the medial side, we have a medial meniscus. What is actually the function of these meniscus? These meniscus have a very positive role in our body. First and foremost, they actually act as a shock absorber. Secondly, they act to deepen the surface of the tibia so that the articulation can easily take place. Plus, they optimize the force transmission across the knee, because as you know, the force has to transmit from the body, has to transfer its weight from the hip towards the knee and eventually towards the ankle during the propulsion or gait of a body. Therefore, this force transmission is highly important during, if there is a lesion of the meniscus injury, this can be problematic during the even normal force transmission through the knee as well. If you see closely, they both appear to be C shapes, but on the medial meniscus is more of a C shape, while the lateral meniscus appears to be a horse hoof type, slightly U shape or more curved than a normal C. There is an anterior horn of the both meniscus and there is a posterior horn of both meniscus, with the body mainly between the anterior and the posterior horn. One way of usually the fiber types consist of type 1 collagen fiber, which consists of almost 90% of the meniscus. It's actually a fibroelastic cartilage because it is fibrous as well as elastic. Therefore, once under compression, it can expand longitudinally as well as radially, and that is where its function comes in. This helps, this expansion under the compression actually helps to not only deepen the surface, always act as a shock absorber, always acts as a force transmitter through the knee. Now in meniscus, this part, which is the anterior horn and the body, is actually supplied by, from the lateral meniscus, it's supplied by the inferior lateral genicular artery, while in the medial meniscus it is supplied by the inferior medial genicular artery, while these posterior horns are actually supplied by the middle genicular artery, which also supplies the ACL and the PCL. Due to this variation, sometimes a posterior horn is usually sometimes damaged along with ACL and PCL, while there can be meniscal injuries associated with trauma as well. Therefore, when we are looking at the blood supply of the meniscus, mainly the blood supply is from the medial and lateral inferior genicular artery, while small portion of the posterior horn is supplied by the middle genicular artery. As I told you, it's actually a fibroelastic type of a cartilage. It contains fibers which may be arranged in two forms. There may be a longitudinal arrangement or circumferential arrangement or radial arrangement of the fibers. Now, the one way of classifying this meniscus is that outer 1/3 is called as the red zone, middle 1/3 is called as the red-white zone, while the inner 1/3 is called as the white zone. This is important because when we are treating the different types of tears of the meniscus, this concept actually comes in because the blood supply is supplying from the periphery and actually going towards the center of the meniscus, and peripheral part of the meniscus are more perfused as compared to the central or the innermost or inner 1/3 of the menisci. And what is important is that this is where the role of actually blood supply comes in the healing of the meniscal tears. Usually the red zones are more amenable to healing, while white zone tears usually do not heal. Therefore, you need to treat them differently as compared to the red zones of the tear.